So the maternal T4, as we discussed, crosses the placenta. The T3 level is low until 30 weeks. After 30 weeks, the serum T3 starts increasing. So you can see that here that the T3 is quite low during the gestation. After 35-36 weeks, it starts going up. The reverse T3, on the contrary, is high during the gestation and comes down after birth. So in premature babies, reverse T3 may be high. And the T4, we have the range, and there is a surge after birth, which starts coming down after 4 to 6 days. There is an acute TSH surge after birth as well, which we will see next. So the surge happens in the first few hours of life for TSH, and it can reach as high as 70 milliunits at 30 minutes. It drops quickly, however, by 1 to 2 days. Most of the time it's normal. So the centers which use TSH for newborn screen can do it after 24 to 36 hours without having too many false positives. That has been my experience as well. And the labs do have differential cutoffs depending on the age of the sample. So they have a different cutoff of more than 15 at up to 3 days, and say 10 after 3 days, depending on the lab we are using and their cutoffs. The neonatal T4 and T3 peak at 2 to 3 days and then start reducing. So don't measure the free T4 very early, it tends to be high. And there is a higher T3 postnatally due to increased T4 to T3 conversion by the type 1 monodeiodinase. So this is the TSH surge, which is much briefer than the T4 surge. The TSH surge is the reason for the T4 to go up. Then it stays high for 2 to 3 days, and then by 5 days it starts reducing back. The TSH surge starts reducing quite earlier, so by 24 hours the surge is almost over. So if you have a differential cutoff, you can do the newborn screen by 24 to 36 hours.